the current thinking is still that we are looking at the start in and around Wuhan and moving backwards, trying to find out how it came there, and whether it came from another part of China or elsewhere. That will depend on the further studies and research. But because of the strong suspicion of certain bat species being the host of this virus, and having found other relatively close virus strains to SARS-CoV-2 in the region, also in Southeast Asia in general, where these bats are living, is a strong indication that that's where the source is.
Well, we're joined now by Dr. Stephen Thomas, who is the Chief of Infectious Diseases at the Global Health Institute in New York. It was 2018 that Dr. Thomas was among a group of scientists who wrote a paper which not only predicted a pandemic, but also the after effects of widespread illness and economic catastrophe. Dr. Thomas, thank you so much indeed for your time. Do you believe, with the idea of a possible future global treaty, that these sorts of events are definitely going to happen again, or may even become more common?
Yeah, thanks for having me. No, I do. I've read what's on the WHO website, and they're all very good concepts, and the concepts that we're very much interconnected in our risk, and so we have to be interconnected in our solutions to mitigate that risk. And yes, it requires that we have robust international surveillance for these threats, the ability to characterize these threats rapidly, and most importantly, the ability to have open and transparent communication in near real time when they are occurring, so the rest of the planet can prepare accordingly.
Yeah, I mean, you talk about interconnectedness. I presume you're talking about nations sharing information with each other, but just tell us also about the effects of human lifestyle and how humans interact with the planet, and how that possibly leads to pandemics like this.
The interface between animals and humans and zoonoses, so diseases, infectious diseases that can transfer from an animal to a human. I mean, that was observed 10, 15,000 years ago when we started to domesticate animals, and we started to live in very close environments. And it happens all the time, every day. You can look at vector-borne diseases like dengue or malaria, which kills millions of people every year. And there are things that we do as humans that bring us closer and increase our risk. So deforestation, for example, that's just one example of how we get closer to species of animals that we're not normally close to, and can allow these diseases to jump species, like we believe occurred with SARS-CoV-1, with MERS-CoV, and now with SARS-CoV-2 and COVID.
What do you think the world is not getting quite right in terms of dealing with SARS-CoV-2?
So I think one of the major lessons learned, at least for me, and I think it applies everywhere, is that it is a real science and it is a real expertise to communicate health information in a way that is not only timely and accurate, but in a way that actually can change human behavior. Because in the end, COVID is still, it's a respiratory virus, it's a respiratory disease, it's transmitted primarily through droplets. And we know that if public health interventions are strictly and consistently applied, for example, wearing a mask and physical distancing, we know that that is a very effective barrier between people getting infected. It's just been very, very difficult on an international level, and certainly in my own country, to get people to, in a large and consistent way, buy into that and execute those interventions.
How worried are you about current variants of concern and also possible future variants of concern prolonging the pandemic, and in terms of how it affects our health? Because clearly treatment is improving and the vaccines at the moment are quite effective against current variants. But what about the idea that we've heard quite a lot that we need to be prepared for this thing to be around for decades to come?
I agree with that comment 100%. So viruses mutate. That's what they do. And evolutionary theories lead us to believe that they mutate for a survival advantage. And that's not always a bad thing for human hosts, for example. But in this case, it seems that, I think it's pretty conclusive that these variants are much more transmissible, anywhere from 30 to 50% more transmissible. But there's also some very strong evidence that they are also more virulent or can cause more severe disease in people. And then the most concerning issue is that these variants might be so different from the original strain that they might be able to escape the immunity that is imparted to us by vaccines. And we've already seen that with some vaccines that were tested in South Africa or Brazil. We have seen that they have lower efficacy against those strains versus the original strain that that circulated from China. So I'm quite concerned that we are very much in a race with these variants to get people to, again, wear masks and physically distance and roll up their sleeves and get vaccinated as quickly as possible.
Dr. Stephen Thomas, really appreciate you sharing your expertise with us on the NewsHour. Thank you.